Around 11% of adult population has got diabetes. Diabetes involves many organs in our body like heart, kidney, eyes. In the same way, it involves the lower limb also. So diabetic foot is very common problem, but much ignored problem, which many people don't have awareness about that. So diabetic foot involves mainly because of the diabetic neuropathy, vasculopathy, and abnormal sugar level. When the sugar levels are high for a long time, it involves the blood vessels and also nerves, which cause vasculopathy and neuropathy. So the main pathology about the diabetic problem is, foot problem is, because of three things: neuropathy, vasculopathy, and abnormal sugar levels. In neuropathy, it involves the sensory neurons, motor neurons, and autonomous neurons. Sensory neurons cause numbness of the foot, which leads to minor trauma which unnoticed and cause the infection of the foot. Motor neuropathy involves the deformity of it because the intrinsic muscles of the foot get damaged and form deformity, which leads to abnormal pressure on the foot and cause the ulceration. And third is autonomous, which abnormal sympathetic causes the dryness of the foot, which leads to cracks and fissures, which leads to abnormal infection on and off. Vasculopathy involves the major and minor blood vessels. So major involvement is because of atherosclerosis of the blood vessels, causing decreased blood flow to the limb. Microangiopathy involves the smaller and venules, arterioles and capillaries, leading to decreased blood flow, lead to ischemia, that decreased flow to the limb. And the third common problem is stiffness of the joint because of abnormal collagen synthesis, causing stiffness of the ligament and stiff joint, which leads to abnormal gait and abnormal position, causing ulceration of the foot. The main problem is awareness about the foot, diabetic foot, and its prevention. So prevention of diabetic foot is more important. So people should aware about their foot. So what are the do's and don'ts in the diabetic foot people? The people who are having arterial problem or neuropathic problem are called high risk foot, which are tend to develop pathological problems. So important thing is awareness about that diabetic foot. So people should prevent the complication of diabetic foot by these things. What are the do's and don'ts in the diabetic foot? Do's are: one, daily clean the foot while bath and dry it and look for any infection or anything is there or any minor injury is there in the body. Second is keep always foot dry. Moisture will cause infection and interdigital segregations. And third is proper footwear. These cause abnormal pressure on the different areas of the foot. So proper footwears are important to prevent the ulceration. And every day after bath, everybody or you should see the foot for the different problem. And important thing is control of diabetics. Prolonged uncontrolled diabetes leads to this problem. So proper control of diabetes will have a prolongation of the neuropathy and vasculopathy, prevention of the vasculopathy. So proper footwears and care of the foot will prevent the diabetic foot formation. Thank you.